I'm tremendously proud of the leadership shown by President Obama that he has shown on this issue. Without fear from political reprisal and in opposition to the special interests that block meaningful progress in Washington, he took up the fight for health care. Responding to his call, Speaker Pelosi joined the fight and delivered out of the House the most historic pieces of legislation of our lifetimes. And now we stand closer than ever to making real progress on health care. Recently, a spokeswoman for Martha Coakley said, "Steve Pagliuca is just wrong on this issue." I'm here to say that if I'm wrong, I'm in good company. If I'm wrong, then Speaker Pelosi is wrong, then our 10 pro-choice Democratic congressmen from Massachusetts are wrong, including Michael Capuano, and they were wrong when they cast that vote. And if I'm wrong, then Patrick and Ted Kennedy Jr. are wrong. When you look at the facts and consider the real choice we're making, the choice between providing coverage for over 30 million Americans who have no coverage and controlling costs for businesses who can't afford spiraling costs or provide no coverage or security at all, it's easy to see who's on the wrong side of this issue. As I've traveled across Massachusetts in recent weeks, I've seen up close and personal the impact of inadequate insurance and skyrocketing costs that have had families that have affected families in our Commonwealth. A few days ago, I met Jeff Kimball. Jeff lost 5 members of his family to cancer in 4 years, including his wife. She had to undergo numerous serious therapies. Therapies occasionally had to be foregone when the insurance company denied care. My heart goes out to Jeff and his family. I've heard from Melody McCauley, whose husband Gary developed multiple sclerosis several years ago. As the disease progressed, he could no longer work, and he lost his insurance and he lost his job. Melody then left her job to care for him. With the loss of her job, she too lost her insurance. The passage of health care reform here in Massachusetts changed their lives. Melody wrote me a note. She said, "I do not understand the outcry over health care reform. Without my public option, I know my life and the life of my husband would be drastically different. Those who are not sure about supporting this, please look at me. 7 short years ago, I never thought I'd be where I am, but things happen, lives change in a heartbeat, and knowing my husband and I have coverage takes one more brick off my shoulders." There are many families who are out there who are not as fortunate. There are many, many stories. A woman who's 22 years old now, she had cancer when she was 6 months, battled through that, is totally cancer-free for 22 years. They're telling her when she gets out of college and gets a job, she will not be covered for pre-existing conditions. That's not fair. Stories like this have been repeated to me as I've traveled across the state. Stories of impossible choices and terrible losses. Stories of good people in unimaginable bad situations. Stories that we can change if we stand up to the divisiveness and politics surrounding health care reform. Not just stories, but lives we can change if we stand up as a reliable 60th vote for health care for all Americans. Make no mistake, abortion access and federal funding for abortion is a real moral issue. I'm strongly pro-choice. I'll fight passionately against any attempt to limit access or availability to safe, legal abortions. But there are other issues central to women's health that need to be weighed here. Women are currently the victims of a broad range of practices by insurance companies that undermine their ability to get adequate coverage. Some insurance companies have used conditions like pregnancy, C-sections, or even history of domestic violence as a basis to deny coverage. Practices like gender rating, where women are charged more than men for similar coverage, are prevalent as well. This year, over 43,000 women will die of breast cancer. The American Cancer Society has found that in cases of early diagnosis, where cancer is still in a localized stage, the survival rate is 98%. But early detection requires mammograms, screening. Unfortunately, the frequency of mammography in women without insurance is half that of women who have insurance. High cost blocks access, that prevents detection and leads to death. With national health care reform, we can fix the enormous discrepancy in coverage. This year, almost 4,000 women will die of cervical cancer, another preventable disease. These women will be predominantly black women in the South, Hispanics along the Texas-Mexico border, white women in Appalachia and the rural Northeast, and Vietnamese immigrants. women who lack access to gynecological exams and pap smears, procedures that are 25% less frequent among those without health care insurance. These are insurance issues. These are women's issues. These are women's lives we can save if we stand strong as a 60th vote for health care. In conclusion, I pledge that if the voters of Massachusetts send me to the Senate, I'll be there on the floor to support a strong health care bill that achieves Senator Kennedy's dream of making health care available to all Americans. Senator Kennedy was right to say that when a bill passes, we will end the disgrace of America as the only industrialized nation in the world that doesn't guarantee health care for all of its citizens. I hope my opponents can begin to see this historic debate in these terms and not fall prey to the traps of old politics. Health care reform has failed for generations because we've lacked leaders in Washington who are willing to stand up and be counted, who refuse to be derailed by these issues. We're at the crossroads today. We cannot detour. We cannot turn our backs on women and families who need fundamental reform in the healthcare system to survive. I will stand with those women and families and tens of millions more who desperately need help now. I'll not turn my back on them. I'll proudly cast a reliable 60th vote for healthcare reform. We must get this done. We must get this done now. We have a window in time. It's failed several times before. It's a national imperative. It's unacceptable, and we must get this done now. Thank you.